If you're watching this on the VLE or you're floated by on YouTube, a very warm welcome. My name is Roy Lees-Oakes, and the aim of this presentation is to form a supplemental study guide for students undertaking the Level 4 Diploma in Counselling. Today we're going to look at the case of the lost conditions, and we're going to start off with Carl Rogers and have a discussion about what he described as the necessary and sufficient conditions for therapeutic change. He wrote in 1957 in the Journal of Consulting Psychology, "Is it possible to state in terms which are clearly definable and measurable the psychological conditions which are both necessary and sufficient to bring about constructive personality change? Do we, in other words, know with any precision those elements which are essential if psychotherapeutic change is to ensue?" And I guess this was the first time that Rogers had brought his ideas of person-centred therapy, or as he called it, client-centred therapy, to a wider audience, and he did it through the Journal of Consulting Psychology. So we're going to talk today about the necessary and sufficient conditions for therapeutic change. They're sometimes known as the core conditions, but as we'll see, there are conditions that are hidden, and the aim of the presentation is to look at those hidden conditions. So let's have a look at what's called the core conditions. Okay, well, the core conditions are empathy, congruence and unconditional positive regard. Empathy in person-centred therapy is the ability to listen to what the client's saying, try and enter their perceptual world, try and see the world through the client's eyes, and reflect back to them their thoughts and feelings about their situation. Congruence is about being genuine, a genuine person in the relationship from the point of the counsellor. And finally, unconditional positive regard, the counsellor's non-judgmental attitude. And it's said that if these three conditions are shown to clients, then therapy will start to take place. The theory tells us that. Now, I'd just like to come on to this notion of the core conditions. Actually, Rogers never used the term the core conditions. It's probably attributed to the British person-centred movement, and it probably is a quirk of training. When counsellors are being trained, there's an emphasis, especially on person-centred therapy, on what's called the core conditions. But actually, Rogers had 6 necessary and sufficient conditions for therapeutic change, and I'll list them here. The first of his 6 necessary and sufficient conditions were the two people have psychological contact. More on that later. The client is in a state of incongruence, being vulnerable or anxious. The therapist is congruent or integrated in the relationship. The therapist experiences unconditional positive regard, and indeed the client experiences that for the client. The therapist experiences an empathic understanding of the client's internal frame of reference and endeavours to communicate this experience. I'll decode that. Effectively, the therapist is trying to understand the client's world as they see it and reflect back to them the thoughts and feelings that goes with that understanding. And finally, the communication to the client of the therapist's empathic understanding and unconditional positive regard is to a minimal degree achieved. So those are the 6 necessary and sufficient conditions or therapeutic conditions. And what I propose to do is remove the ones that we know as the core conditions. So watch those disappear. There we go. And you're left with 3 conditions. The 2 people have psychological contact. The client is anxious or incongruent in the relationship. And the client understands that the therapist is trying to help them. So we split them really into the client's conditions and the therapist's conditions. We'll have a quick look at the client's conditions. Well, these are the ones we know as the core conditions: congruence, unconditional positive regard, and empathy. These are the 3 of the client's conditions. If the client receives those from the counsellor, then the theory tells us that therapy starts to begin, and the person's natural self-healing abilities will start to actualise. So let's move on to the hidden ones, and they're also known as the core conditions. I'll put that up there. The Counsellors Conditions. Well, the Counsellors Conditions, I've just put them up here, just if you want to make a note of them. We'll look at them individually. These are really useful for the counsellor to assess where the client is in therapy, because we all do that. You know, that's part of being a therapist, is that you try to kind of work out, not analyse, but try and work out where the client is, and sometimes you bring that up in supervision. So we'll have a look at these hidden conditions in a bit more detail and why they're called the Counsellors Conditions. Well, first of all, the first hidden conditions is the two people have psychological contact. Well, ethically, a counsellor should be assessing if their clients are psychologically present. Clients may not be in psychological contact. If they're intoxicated, maybe it could be substance misuse or alcohol or drugs, sometimes even prescription medication. Sometimes clients have severe mental health issues and they can have psychotic episodes. That may also limit the client's ability for psychological contact. Now, you know, you may work for years and never come across a client who turns up under the influence or has become mentally unwell. But as counsellors, we have to make an assessment where or if the therapy is consensual, whether the client understands they're having therapy. And there's always a bit of an ethical thought there. If the client doesn't understand why they're there or what they're there for, then possibly ethically, almost certainly ethically, you may be wanting to think about, well, actually, if they don't understand why they're there, they don't understand that they're there for therapy, then actually, can you really continue? Because A, they may not understand why they're there, and B, they're probably not going to get any benefit from it. And in that case, you may want to recontract and see them again, when they present differently. And sometimes that does happen. The second of the hidden conditions is the client needs to be in a state of incongruence, being vulnerable or anxious. I'd ask this: is it ethical to counsel a client who does not have issues or difficulties they wish to explore? Certainly, if you're a paid therapist, if you're making money out of therapy, is it ethical to take money off somebody when clearly they haven't got anything to talk about, that for this part of their lives they're pretty much sorted out? So again, we have an ethical obligation to consider if their clients or our clients are using therapy appropriately. And it's possible occasionally you get clients who are turning up and they just want a bit of a chat. Maybe they're lonely. Maybe they want to talk about something else. They might want to talk about something not related to counselling. Might want legal advice or housing advice or myriad of other things. And if they're not having difficulties that the counsellor can work with, then they need to consider can the relationship continue. And finally, and I think this is an important one, the communication to the client of the therapist's empathic understanding and unconditional positive regard is to a minimal degree achieved. At some level, the client needs to understand the therapist is trying to help them. And we use the term therapeutic alliance, and it's to signify that the client and the counsellor are working productively. In other words, the material is being brought and the client is looking at themselves, thinking about how they can change, what they can do to change. Rogers talked about client-centred therapy as a growth model. So this is what it was about. It's about looking at personal growth, looking at what you want to stay the same, what you might want to change in life, and how that feels to go through those changes, maybe with other people, maybe with yourself, how you act and behave. If that really works, if a therapeutic alliance is struck, then you can work at relational depth, where the client and the counsellor become very kind of emotionally close, not attached, but they become to a point where the counsellor is really entering the client's perceptual world, almost as if they're walking into the client's mind, to want a better phrase, I suppose, actually really seeing the client's world, including the thoughts and the feelings that the client is having. But I would say this, you have to have a minimal degree of trust between the client and the therapist. And sometimes that doesn't happen. Not every client will like every therapist, and vice versa. There may be lots of reasons why people don't strike a relationship up, but if there's no minimal kind of trust there, the therapy isn't really going to continue. If you want any further information, if you're watching on the VLE, just click the resource tab above the red arrow. Or, if you're watching on YouTube, if you click the box below, you see the red arrow just pointing in there, I'll put the hyperlinks on so you can go to some other interesting resources, including a really interesting article by Keith Tudor, who coined the phrase, or termed the lost conditions. And finally, thank you for watching.